This is the pelvic tilt. This is great if you have a flexion preference, that is you like bending more, or a great starter exercise if you're in pain and you need something just to get going. So if we're looking from the side, let's consider our spine. You can take a look at my low back. This is a neutral position for me, all right? I'm as tall as I can be. This is a natural posture. What we want is for you to be able to find this space when you lay on your back. Then we also want you to be able to control this. So by control, we mean we want you to be able to arch your back, and we want you to be able to round your back. And when we're doing our pelvic tilt, this motion of my pelvis underneath my spine is what we are looking for. Can you arch and can you round? All right, so to get into the pelvic tilt, my feet are on the floor, my hips are on the floor, my shoulders and my head, they're all resting. And I want to feel what my neutral spine is like in relationship to the floor. So what we're talking about there, just like we were talking about standing, we have a natural curve in our lumbar spine, and that should provide a little bit of lift, or there should be a little bit of space between your spine and the floor. When we're doing our pelvic tilt, we're going to be pushing your low back down into the ground. And so as we do that, we create that tuck of the pelvis that we're trying to gain access and ownership over. This tuck of the pelvis is what's going to allow me to begin to move more and more smoothly through the rest of my spine. So pelvic tilt, I find neutral, I relax everything in terms of my shoulders and my head, and I just try to move from my pelvis. So I roll that back, I push my low back into the ground, I hold for 2 seconds, and then I relax back to neutral. So I can do reps of this. Let's say a good starter amount would be 2 sets of 10 reps. But as I get better and better, then I'll work to expand my range of motion. So where I'm no longer just tucking and then going to neutral, but I can tuck and then go into an arched position. I'm really working further into my range of motion and creating a higher lift in my spine. So here would be the tuck, here would be the arch, higher into my range of motion. And so I'm working more and more into expanding ownership over that space. Once I've done good with that, I know that my spine can tolerate the pelvic tilt. Then I will work single leg flexion. So I'm just going to pull my leg to me. This is going to stretch one side of my low back and hip. And I'll just let my other leg relax down towards the ground. Pull my front leg, I'm bringing my knee to my chest and giving it a hug. I can hang out here as long as I'd like. I want to make sure I stretch and switch. Then to progress that, you'll go to 2 legs. So you can bring one leg up and then bring the other leg up. This is big max flexion. So if you think about my low back is now pressed into the floor. My hips and my pelvis are tucking up. So this is the fuller range of motion, the max range of motion of what a pelvic tilt can be.